Hello everyone and welcome to my channel and another video about clinical pharmacy practice. In today's video, I'm planning to talk to you about something that came up from a few of my followers, a question that they asked about clinical pharmacy specialists, how to qualify for a clinical pharmacy specialist position, what education is needed, what experiences are needed, and all that stuff. So I'm going to try my best to answer all these questions in today's presentation. And hopefully by the end of the presentation you'd know what's needed to apply for a clinical pharmacy specialist in terms of education and experiences. And I'm also going to give you a few tips that would help you build your portfolio so that when you apply for such positions, hopefully you don't get rejected. So for those of you who are new on the channel, welcome to the channel. This channel is all about clinical pharmacy practice. I teach you how to become clinical pharmacists, how to advance your career. I also teach you how to pass the pharmacist OSCE exam, and there's a chapter about immigration. So if any of these topics interest you, make sure to subscribe to the channel and activate the notification bell so that you get notified of my future videos. All right, let's get started with today's presentation and a little bit of introduction. Of course, you know that hospitals and primary care sectors are overwhelmed and they're facing lots of shortages in doctors, pharmacists, and every single healthcare professional. Sometimes patients can't even find a primary care doctor to take care of them, and they have to be on a waiting list for years before they can find someone who would accept them as a new patient. And also, specialist doctors don't have the time to optimize patients' medications, which sometimes take up to 30% of their time. So there had to be something, there had to be a solution for all of that. Clinical pharmacists are also facing shortages, and most of them are not specialty trained, so they can't cover certain specialties without the training. They have the education, but they don't have the training. And that's why they created this thing, the clinical pharmacy specialist positions, and then they put them down out there to help the doctors take lots of patients, any patients that have medication related issues that need optimization would just go to the pharmacist, the clinical pharmacy specialist, instead of taking that time out of the doctor's time, specialist time. And that's basically how it all started. So basically, with a little bit of training, a clinical pharmacist can become a clinical pharmacy specialist, given that they have the proper education. So clinical pharmacy specialists are clinical pharmacists who have completed a doctor of pharmacy degree in addition to advanced postgrad training in a specific field. That could be a residency, a year 2 plus year 1 residency, or it could be some other sort of training. For example, many clinical pharmacy specialists are certified by the Board of Pharmacy Specialties. Yes, we do have a Board of Pharmacy Specialties in the United States, and any pharmacist can apply and become a specialist. For those of you who don't know about it or haven't heard about it, we do have specialties in pharmacy, and it's an accredited board worldwide. So wherever you live, you can apply and take those exams and become a specialist. Of course, there are certain requirements that we're going to go through later in this presentation. And most CPS pharmacists, CPS stands for Clinical Pharmacy Specialist, pharmacists are authorized to prescribe. So they can actually prescribe in the absence of a doctor. They don't have to call a doctor and get a verbal order. They can take care of everything, order and follow labs, and perform most of the functions that a clinical pharmacist performs. Some duties and responsibilities of a clinical pharmacy specialist are, as you can see, facilitating pharmaceutical care services, of course, and direct patient care programs, medication utilization systems. Basically, most of them run clinics. So you'll see a diabetic clinic run by a clinical pharmacy specialist. You'd see an anticoagulation clinic run by a clinical pharmacy specialist, and so on. Design and implement stewardship activities. That's another thing they do. For example, if they work at a hospital setting and that hospital is fairly new, they don't have like something like an antimicrobial stewardship, a clinical pharmacy specialist on board can start an antimicrobial stewardship, for example, and create the whole guideline that would help optimize the use of antibiotics in that hospital. This is just one example. There's also opioid stewardships. Also, actively identify practice-related issues which require evaluation and facilitate clinical research projects. As a clinical pharmacy specialist, they are required to do a lot of research as part of their job requirement. So that's one thing. And also research about any gaps in the workplace that need to be fixed in order to increase the quality of the workplace. Work as an active member of a multidisciplinary team and collaborates with healthcare providers. This is something that even clinical pharmacists do. It's not nothing new. Makes appropriate evidence-based patient-centered medication recommendations. That's also something that clinical pharmacists do. Participates in the management of medical emergencies. That's something special, so they probably get extra training to, for example, participate in a code blue. A clinical pharmacist usually is not involved in a code blue, depending on where you work. However, a clinical pharmacy specialist who is specialized in emergency medicine probably participates in code blues. So he'll be one of the people in the code on the code team, and he'll be taking care of the medication part of the code. What's next? Provides discharge medication review, reconciliation, and counseling as appropriate. Now, this is something that a clinical pharmacist also does. However, because clinical pharmacists are really overwhelmed and they are overloaded with work, most of the time they can't take care of discharges, so discharges will get missed. And in an area such as a cardiology, a CCU ward, or an ICU ward, having a clinical pharmacy specialist over there can help a lot with discharge medication. So a clinical pharmacist will take care of admission medications and admission reconciliation and all that stuff, but then a specialist would take care of the discharge prescriptions and meet with the patients and counsel them on those on the use of those medications. Finally, on this list, maintains proficiency in preceptor roles and actively emulates education, mentorship, and skills. This is something that a clinical pharmacist does as well, by taking students, residents, and teaching them the practicum part of their programs. Now, this is just, it's not a full list, but I did research the most important tasks done by clinical pharmacy specialists and brought it to your attention. However, there could be other tasks that they do on a daily basis as well that I didn't bother bringing here, because it's basically what a clinical pharmacist would do as well. Some examples of the duties of a clinical pharmacy specialist are under the physician-pharmacist collaborative management agreement. The clinical pharmacy specialist can perform, number one, adjusting medication doses such as warfarin, and I'm basically talking about the anticoagulation clinic here. This is something that when a patient gets discharged from the hospital and we start them on warfarin, they're still in the early stages, so they need some INR monitoring, for example, and somebody has to follow up in the community. And usually it's the doctor who follows up on the patient, but because they're busy and they can't see the patient very frequently at the initial stages, a clinical pharmacy specialist running a clinic that is an anticoagulation clinic can see the patient as frequently as they want and order the labs and adjust the warfarin dose. That's just one example. Provide consultations that are disease specific. Again, under the referral of a doctor, doctors can refer patients to the pharmacist clinic to control their diabetes, blood sugar, for example. They are unable to control their blood sugar. They've tried everything. They've been increasing their insulin, maybe the basal insulin, but the numbers are still high and they don't know what to do. And the hemoglobin A1C is also elevated, so they don't know what to do. and then they refer them to the pharmacist clinic, the clinical pharmacy specialist clinic, and they take care of optimizing those patients' medications. There are also heart function clinics everywhere in the States and also in Canada. So they take care of any heart-related medications. So those are other examples that involve a clinical pharmacy specialist. Another task down there is recommending optimization of opioid therapy and opioid stewardship. And this is something that they can actually create and optimize because the use of opiates in North America, it's not like it's not black and white, and there are so many practices that may not follow any guidelines or even have any guidelines to follow. So you'd see a lot of too long-acting opiates used in one patient, which doesn't make any sense, right? So having a clinical pharmacy specialist specialized in opiate use and opioid stewardship can make a big difference. Managing medications for mental illness disorders. Again, this is a very highly specialized area that requires someone with great knowledge and experience in mental illness treatments in order to optimize those patients' medications. And also remember that this area, psychiatry in general, have vulnerable patients that could be of any age. So they need someone who really knows what they're doing and are really highly specialized in psychiatry, so to take care of their medications and optimization. Optimize heart medications to avoid unnecessary hospitalizations, like I said earlier, in heart function clinics, and precept PGY1, PGY2 pharmacy residents whenever there is a new resident. These are just a few examples that I brought to you from my research, but there could be other examples as well. Education requirements for clinical pharmacy specialists. So first of all, of course, they need to be registered pharmacists, so a graduate of an ACP accredited college of pharmacy if they are in the United States, or they have to be pharmacists, like registered pharmacists in North America, in order to be able to qualify from an education perspective. Having a Doctor of Pharmacy degree or other advanced degree is also preferred. So a Doctor of Pharmacy, a Master's degree in clinical pharmacy, or a PhD degree in clinical pharmacy. Those are mainly the degrees that would qualify you for a clinical pharmacist specialist. Experience-wise, completing a PGY1 at least pharmacy residency, and preferably a PGY2 specialty residency. 2 to 4 years of hospital experience usually required, and of course certification from the Board of Pharmacy Specialties. That is optional in case you don't have a residency, so that will take place of the residency requirement. The most common clinical pharmacy specialties available today are in front of you right here on the screen: ambulatory care, cardiology, compounded sterile preparations pharmacy specialty, and critical care pharmacy, emergency medicine, geriatrics, infectious diseases, nuclear pharmacy, oncology pharmacy, pediatric pharmacy, pharmacotherapy, which basically covers all of these, and psychiatric pharmacy specialty, and finally the solid organ transplantation pharmacy specialty. So we have plenty of pharmacy specialties available today that you can apply for any of them, whichever you feel you want to be a specialist in, or you've been practicing in that field for so long and you want to become a specialist. And just choose one and take the exam and become a specialist. So let me show you before I end today's presentation. That's all I have to say about clinical pharmacy specialists and how to apply for them. But I wanted to show you a website where you could apply for any of these specialties, actually, to see what's required, because they have some requirements in order to qualify for them. Let's take a look at this website. So this is basically the Board of Pharmacy Specialties website, and it's bpsweb.org. I'm going to leave the link in the description for you to make it easier for you. And this is where you go to apply for a specialty. There's no other place to apply for a specialty, so this is basically where you want to go if you would like to become a specialist. And what I wanted to show you, it's a massive website that you can browse on your free time. But up here, BPS Specialties, and those are the ones I've been talking to you about. So let's take a look at one of them. For example, let's take a look at cardiology specialty. And if you scroll down here, there's a video you can watch. Eligibility requirements. This is what I wanted to show you. They also have an outline that you can read. So for eligibility requirements, you can see a few points here that you have to obtain these things or have them before you can apply. So first, graduation from a pharmacy program accredited by the Accreditation Council of Pharmacy Education in America, or programs outside of the United States as well can qualify for this. So don't get discouraged by the first part of this. They have to say that because most of the applicants are from the United States. However, if you're not from America, you can still apply. To a current active license registration wherever you work in the US or any other jurisdiction. So you have to be a licensed pharmacist. 3, demonstration of practice experience in one of 3 ways. So you have 3 ways here. You have to qualify for one of the 3. The first one is at least 4 years of cardiology pharmacy experience. So you have to be practicing in a cardiology setting, like a CCU, for example, at a hospital or a heart function clinic or something like that, something cardiac related, with at least 50% of your time spent in that practice, and that should be in the past 7 years. So you need 4 years of experience in the last 7 years. Or successful completion of a PGY1. So basically you have a residency, a year 1 residency in the past 7 years, plus only 2 years of cardiology pharmacy experience. So a residency drops 2 years of experience. The third way to do it is by completing a PGY2, a residency year 2, and in cardiology, of course. And that would drop all the other years of experience. You basically have 2 years of cardiology focused experience from your residency, and that would be enough. So as you can see, there are some requirements. They are not impossible to achieve, but you need to work on yourself, especially like if you're a fresh grad, you just graduated from pharmacy school. This is the time you should work on yourself, because in the next 4 years, you want to be somewhere else. You don't want to continue doing what you're doing today as a fresh grad, right? So, and if you're not a fresh grad, you probably have a massive amount of experience somewhere in some field. So look at which field you've been practicing within and apply for that specialty and become a specialist. Why not? You probably have enough education and experience that would qualify you for that. For example, pediatric pharmacy. I know a lot of people, clinical pharmacists, who are working in pediatrics for over 10 years. So why not apply for a pediatric pharmacy specialty, for example? And psychiatry too. So critical care. These are specialties that most of us work within the field, and we don't even think about applying for a specialist position to become more specialty focused on that part only. Of course, the most common one is pharmacotherapy. I carry a pharmacotherapy specialty, and I used to carry a cardiology pharmacy specialty as well. If you look down here, it sounds much easier because pharmacotherapy basically is seeing a lot of patients from different areas. So not necessarily only cardiology or only psychiatry or only pediatrics or whatever. No, you can see patients from all over the hospital, and you would still qualify, and they only need 3 years of pharmacotherapy experience. So it's a little easier than other specialties. Bear in mind, you can always carry 2 specialties if you want, or even 3 or 4 or all of them. It doesn't matter. But bear in mind that every time you apply for a specialty, it costs about $700 to take the exam, to apply for the application and take the exam. And the exam is very difficult. It's not that easy. I don't think it's just an MCQ easy exam that will ask you about pharmacology or anything like that. No, it's cases based exam, full day, like 8 hours with a break in the middle. And you can read about it later on this website. So very stressful. You don't get to take a break except in the middle between the paper 1 and paper 2, or right now they do it on a computer. They used to do it on paper. The last time I took it was on a computer, and you'd be really stressed out and tired and exhausted at the end of the exam. It has a lot of bias statistics and a lot of regulatory issues. It's not just all focused on pharmacotherapy or treating patients, but there is a massive amount of cases, of course. So yeah, if you want to do 2, fine, but every time you have to renew your specialty, you'll have to renew 2 specialties. That means when you renew your specialty, you can either take an exam or you can do 120 hours of continuing education that they specify for you, not just any continuing education that you have to pay for. And per specialty, it can cost you anywhere above $1,000 for continuing education only. So there are certain costs that come with the with those specialties. So you have to keep that in mind and read very carefully about them before you apply. And that's mainly the reason why I kept 1 specialty only, because I chose to take the exam every 7 years, and that's how long it stays with you. Once you pass, you're specialized, you have 7 years to carry your specialty, and then you have to renew it. So every 7 years I'll just apply for another exam, to retake the exam, and I pass, I take it up another 7 years, and so on. And it cost me about $700. But if I would do 2 exams, it would have cost me $1,400, which is a massive amount. I mean, yeah, it's every 7 years, but still a big amount, and so on. Some people have 3 specialties, so that's a lot of money. So yeah, these are things to keep in mind, and I hope I've covered everything now. If you have any questions, let me know in the comments. I'll be very happy to answer your questions, including questions about this website and their application. Hopefully, yeah, I've covered everything in regards to the clinical pharmacy specialist positions. Salary-wise, they get paid a little bit more than clinical pharmacists. It's not a massive amount greater, but you see less patients, so that's great. I basically, for example, see 10 to 15 patients a day, as opposed to clinical pharmacists who see 80 to 100 patients a day. So that's a massive difference, right? And the pay is much better. So that's all I have for a clinical pharmacy specialist position. Let me know in the comments if you have any questions. And thanks again for watching the video today. Have a great day.